probably die out. The disease should die out. The virus should die out as we move through October and into November.
All right. Thank you very much, Tom. Let me bring in Dr. Lolita McDavid. She is the medical director for the Child Advocacy and Protection at Case Medical Center in Cleveland. Doctor, thank you so much for your time yet again. Let me start off with Eli Waller's case. I know you did not treat him, and you know the details that are being reported just as we do. But September 25th, according to the reports from information from his parents, was showing no symptoms. As Tom reported, he had pink eye, but he's tested positive. We've been given families the advice from pediatricians, keep an eye on your child, look for symptoms, but if there are no symptoms, what are you to do?
Well, one of the things we do know about Eli, and I know this from the media, is that Eli was one of triplets. And triplets are often born premature, and they sometimes have lung problems. So Eli may have had an underlying lung problem that had not been diagnosed. He'd done pretty well. We don't know that. When he died in his sleep, he would go to autopsy, and they would do viral cultures. And that's how they found this time. So there's a lot that we still don't know. We do know that children who have respiratory problems, specifically asthma, don't do as well with this enterovirus.
Yeah. And we've noted that, and parents have been told that as well. You also heard, Tom, a report that in October we should see these numbers, or around October, dwindle down. Explain that.
Well, this is a virus that's in the coronavirus, the rhinovirus, the kinds of things that we see that cause, quote, the common cold. And so it presents like that, with sneezing and cough, runny nose, and maybe some aches. Children, unfortunately, are little hotbeds of infection. They touch things, they put their hands to their face, to their mouth. You have to constantly sanitize things. And when I say sanitizing, I'm not talking about just using a hand sanitizer. You really need to teach children how to wash their hands, do a 20-second wash where they sing something that takes them about 20 seconds. It can be Happy Birthday, it can be Yankee Doodle. You figure out what you do and teach them how to do really good hand washing, because they touch a lot of surfaces and then they're constantly touching their face. So it's very easy for them to get infections, and they don't have immunity. We're not seeing this virus strike adults the same way it is children, because most adults will have immunity.
I know you pointed out teaching them how to properly wash their hands, but let's face it, you know, first grader, second grader, kid in kindergarten, they're going in and out. They're not washing their hands. At best, maybe when a parent picks them up from school, you might give them a little hand sanitizer before they get in the car. And I'm curious if you think that more schools, for example, as we see with cruise ships, when you now get on a cruise ship, there's the hand sanitizer machine so that you get a little gel and cleanse your hands, or even buses should be equipped so that children that they're not reliable in that way to wash their hands. We know that. We'll be able to at least have that bit of defense, even though it's, as you pointed out, not the complete picture.
I think it's actually easier to teach children how to wash their hands correctly, because they like water play and they like to be in the water. Adults are the ones that scare me. You know, you go to the bathroom, a public restroom, and you see people come strutting out of the stall and just go right on out, and you want to go, hey, wait, you forgot something. Children, you can teach them, and then it becomes a part of what they do. So I'm not as concerned that we can't teach children how to do this. And I prefer washes, because it gets under your nails, it gets into the cuticles, it really does what you want it to do. I think that sometimes people get a false sense of security with hand sanitizers.
That's a great point to make, and as you point out, kids are, once you get them into a routine, that does become a part of their habit. Doctor, thank you so much. You always give such great information to parents with these concerns that we have all too often. Thank you. And developing now, ICE's advances just hours ago.